So where are we here? What is a line to say that she's not going to ovulate versus once she's married, her stress level comes down, she can spontaneously get ovulated and then she'll get married. She'll have a child. So we need to understand it's all interlinked, linked to the stress, linked to the weight, linked to the diet you take, linked to the happiness you have in life. So it's not all medicine. And the last question which I get is, how long should my daughter take the medicine? Is she going to be on that? I always say, as long as stress is there, better to keep it under control till she thinks of pregnancy and marriage and pregnancy. It can be 2 years, it can be 3 years. Let her education be over. We'll keep it under control by keeping the medicine. Let her continue the exercise, dietary and thing. Doesn't matter. I am on medicine for such a long time, 3 times 4 years. What we need to understand is disease is bigger than the medicine. PCOS can be more detrimental in many ways because metabolic syndrome, when it comes in the long run, can even cause not just infertility, very early onset endometrial carcinomas. We do hysteroscopy for a 25-year-old, 24-year-old girls for infertility. We end up multiple polyps and that will be endometrial CA.
Oh my God.
So unopposed estrogen is dangerous, not the treatment.
Yeah, so we have to look into the risk-benefit ratio.
Yes, that's when we tell them it's every 6 months we check the hormonal levels and say it's well under control. Keep it like that because you're going to continue the stress for her. She's going the career way. She's going to have stress. But yes, when we need the pregnancy, we take it off. Then you become pregnant. Maybe you might never need it afterwards if you maintain your dietary things. But the whole purpose in today's social norm, whether we agree or not, are 2 things. 1, getting pregnant and having a child. 2, having regular cycles. 3rd, having we started the discussion, the body image, looking good, self-confidence, having things. But nowadays, luckily, girls are much more confident than what they were even 5 years before. I think the whole image consulting thing has gone a better way nowadays. But we do see the spectrum where how many are there the other side, how many are there the other side. When we used to go to schools, from school awareness classes, we used to do 5 to 6. In a smaller schools where we go, we talk for all the kids from 5th to 10th class, we make them sit and talk about this and all. We did have a girl who used to always be in the benches, and then PCOS was her main thing, and I discussed about her. She got her parents and came to me in the clinic. Then the transformation I saw her by the time she came to 10th class is like a bud going out into a beautiful girl, confident levels. The way she groomed herself is something which I think that if we just support the kid in both making her understand the pathophysiology, because we spoke about vicious cycle. They are depressed, they eat more junk food, and then again they don't get up and go out because they don't want to go into public. So no exercise, they don't go to gym because she thinks that somebody is going to body shame her, and again they're going to become. So this is something which we need to.
So a very important 2 things which I have learned. One is I think when a girl who is reaching at the age of puberty and does not get the normal menstrual cycle, she will be under a lot of pressure from the mother and from the grandmother also.
Right.
And that stress can also aggravate the problem.
Everything.
And it can take away her confidence. The second thing which I learned is that disease is more severe than the drug.
Yeah.
So one should not look at the duration of the drugs.
Side effects, the so-called side effects of the disease are detrimental. You will end up having a heart disease. I mean, we do know that whole hyperlipidemia syndrome, metabolic syndrome, hypertension, diabetes, heart disease is one thing, hyperlipidemia is one thing, but the malignancy is associated. And leave the depression, leave the rest of the things which come together. The pressure of infertility, pressure of everything.
So it's like normal physiology converting into the pathology.
Yes, totally. And something which we can get it back. Remember, we can totally keep it under control with the help of a little help from a doctor. A lot of yourself and a little help from us.
So another question is, what is the level of PCOD causing infertility? Because in a practice, what is the percentage of people who have PCOD? Because I know that there could be asymptomatic PCOD also.
and lean PCOS
Lean
also.
PCOS
They don't
also.
have to have anything. Just see, we have 3 sets of symptoms which I said. One is hyperandrogenism, where testosterone levels are high. So where they go with only acne and hirsutism, and they don't have anything, then they go to the dermatologist for their treatment. Then they realize this is hormone-induced things, and they send to us. Then the other set is the hyperinsulinism category, where obesity, acanthosis nigricans, all those things start coming, and then they come. They have lethargy, they have everything that goes with that, and then they come to us. Third would be the whole hormonal imbalance which comes. These 3, when 2 out of 3 are there, when we label them as PCOS, all 3 need not be there. So they can be lean. They do better with the rather than the lifestyle and the med spa. They do lean PCOS do better with laparoscopy when we do it. Obese PCOS do very well with a little help from us with the metformins and their exercise and everything. So not all patients, just because you have PCOS, you should have irregularities. Not necessary. And same way, if you have PCOS, it is not necessary you have infertility. Like I said, if there is a lot of confluence of many symptoms, that's when we see patients. So we have at least 50% having infertility issues, because point we need to understand with infertility is, even if the woman has normal, everything normal, 1 year is a time we wait before we even call them infertile. Means everything being normal, hormones being normal, ovulating normal, it still takes 1 year. That is first thing. Second, in the whole month, we have only 1 day which is fertile. We don't know, nobody can predict this. Retrospectively, we can say that 14 days ago she had ovulation, but prospectively, nobody can predict that from today, on 15th day, she's going to have ovulation, so have a planned intercourse. Nobody can predict that unless you're doing a follicular study scan. So when the patients come to us, I just say, just leave it. Just have a peaceful try for yourself between day 11 to day 21. At least alternate day for about 6 months. You don't become pregnant, then come to us. Let us induce you for ovulation. So you don't have to jump. Don't have to think that I'm not going to ovulate and I'm not have to, just because I have PCOS, I don't get pregnant. This is not a norm. Don't allow this stress to come on.
And in fact, infertility itself is a very vast topic.
Yes.
And it's not only about the female part, it's sometimes it's the problem in the male counterpart.
Abhishek, you cannot believe 30% is female, 30% is thing, but 40% is both. Yes. Nowadays it's more and more.
In fact, because when we see obese men, they have infertility because of all those problems, obesity, and the performance
libido
issues.
itself also will be decreased in that obesity.
So I have a story to share, because I remember this lady, Indian girl working in Dubai. She came to me with her partner before they were getting married for counseling. I think it was more like a counseling of the men.
Yeah. Okay.
And then she told me that, doctor, I have a very strong family history of infertility and PCOS, obesity, diabetes, everything. And her BMI was around 42. She already had all these metabolic problems. So then I gave them all the options, and she had already done her research. She said, doctor, I want to undergo bariatric surgery. Then I told her, obviously, because when we do bariatric surgery, we ask them not to conceive
for 18 months
at least first year, because that's period of weight loss. So I did bariatric surgery upon her. She got married, and then after maybe 1 year, before even that, she used to send me messages, doctor, for the very first time, I am getting my normal cycles without any tablets or anything, and I feel like a complete woman. That's the cycle of a woman when it's about menstrual cycle.
It's 2 things. One is periods, one is pregnancy. Unfortunately, that's the way the whole society here works.
And then after some days, she texted me, doctor, I'm pregnant. And then suddenly one day she sent me a picture of a little baby girl. Said, doctor, I delivered a baby girl. So, sometimes, and she didn't have to undergo any treatment, IVF or anything, because she understood the gravity of situation. She know that what is the family history and what she's going through. So sometimes it's very important to think logically.
And you know something now, Dr. Abhishek, that even 10% decrease in their weight will resume the cycles by themselves, and ovulation can start. See, if you say 10%, how much is it? Maybe if you are about 95, it is around 9 kgs. So, and then your ovulation starts by itself, you can become pregnant by itself. Means if you take your norm, 95 minus 9 is only 86. It's still obese, but still, it's such a sensitive thing when it comes to ovulation. They start ovulating and they can become pregnant.
That's why we have this concept of healthy obese.
Yes.
But what I have come across, it's very easy to lose weight.
Okay.
The most difficult part is maintaining that weight loss.
Right.
So most of the people who come to me, they have already tried all the methods and all the measures. I'm the last resort.
I know. So, nobody wants surgery. You can remember that.
So it's anyway. If somebody walks into your room and say that, doctor, I just have obesity. I always give this example of boiling frog. If you put a frog into boiling water, it will immediately jump because it senses that there is something wrong. There is a danger. But at the same time, if you put a frog in a lukewarm water and you start boiling it, it will never realize and it will die. Because then the danger is coming very slow.
Yeah.
The same thing applies with this lifestyle disorder, obesity, PCOS and all these problems. By the time person realizes, it's already too late. And then they have all these thought process, oh, should I start doing exercise? Should I start doing dieting? But unfortunately, it's very easy to, it's very easy for us because we are in a good shape.
Right.
We can say, oh, weight loss. So, it's like telling somebody, go to Tirupati Balaji and your problems will be solved.
Right.
But I'm not going to tell you how to reach there. So they know the destination. Everybody knows the destination.
Everybody wants to lose.
But they don't know how to reach there. So they try different kinds of diet. They try all those weight loss powders. They try weight loss.
End up with other diseases.
Yeah. So there is a paper published on this weight loss powder causing acute liver failure.
Liver and even kidney. Both. And this so-called high protein diets, that's a load on the kidney. People have to understand it's a balanced diet we have to look at and losing it the healthy way.
The problem is in India when we say diet, people think that starvation.
Fasting, yeah.
So they don't understand the concept of balanced diet.
Yes.
So whole thing is on the wrong side, and the problem is, as we mentioned, that the biggest enemy of today's world is the sugar.
True.
And we have been made addict of sugar. True. You look into any newspaper, the front page, the whole page newspaper will have an advertisement for a chocolate brand. I'm not going to name it.
Okay.
Imagine the amount of money they're spending on the marketing.
I totally agree. I think everything's that sells. That's it. That's what I said. When we started off with junk food started coming like a thing, there was a time when people used to think, in China nobody would be obese or anything. But once McDonald's went there, then we have to label that. We have started seeing obesity in that area. We talk about basic metabolic rate being very high in the northeastern country. That's the reason why they don't put on weight in these countries. But then the food went and that started decreasing everything. Yeah.
So this conversation can go on for hours. There will be no end, and probably we'll be meeting her again sometime later and with something new. And I really want to thank you for accepting this conversation, and it's really going to be helpful for not only for general population but also for doctors for counseling their patients.
True.
And we have to understand from their perspective.
Right.
We have to wear their shoes and think from their perspective.
I totally agree to you with this, but I always tell a doctor should become sick once in whatever thing, unless to understand the patient's perspective, patient's way of being restless when something goes wrong, and waiting for a doctor, how painful it can be. Yes. And waiting for a solution, because we all of us think that we are becoming, at least this is something I am very strong about, is that we are slowly becoming defensive doctors. But we need to understand, yes, we are scared about patients who are going to be litigant, we are scared about patients who are going to be asking so many questions, but we need to understand the clinical acumen which we have, they do not have. So we need to be thinking ahead and say that, yes, you have this, if you don't do this, this have to be there. So we need to be very practical, tell them and come up with solutions, because they have come here for solution. But the trust factor is broken somewhere. So we need to develop the trust between the patient and doctors again, and be more of goal-oriented, that is solution-oriented. That we need to do that.
Thank you so much. And catch you in sometime later in some of the next episode, and probably will come up with some more topics which are of social relevance. Thank you so much.